So my areas of interest in clinical research in general practice is in women's health, child health, as well as medical education. These are the areas I tend to focus on, and my areas of interest in medical education is primarily focusing on students as well as registrars, whether they like to choose general practice as a specialty. My name is Dr. Ramya Raman. I'm a specialist general practitioner and practice owner. I'm also a clinical researcher and discipline head for the University of Notre in Fremantle, Western Australia. I also hold the position of chair for RACGP WA. Research in general practice is actually very challenging. It's challenging because as a clinician in a small practice, there is actually no significant support that is overtly available to support a GP or a clinician to go, I would like to get involved in some practice-based research. And the funding and supports are still quite fluid. So my interest in research has come about because of my patients. When I see my patients, I go, well, why this medication and why not this? What are the things that are barriers for patients to seek appropriate care? So my areas of interest in clinical research in general practice is in women's health, child health, as well as medical education. These are the areas I tend to focus on, and my areas of interest in medical education is primarily focusing on students as well as registrars, whether they like to choose general practice as a specialty. It's about understanding the nuances of that. And in women's health, there are topics in consideration in relation to heavy menstrual bleeding, the causes around that, what are some of the taboo that's associated with it, but there are multiple topics in women's health that is actually very relevant to general practice. I just want to also say that the RACGP has an RACGP Foundation, which is the Research Foundation. The Research Foundation is an excellent structure that is in place within the Royal Australian College of General Practitioners. The RACGP Research Foundation supports general practice research by appropriately allocating funding if the research project is going to be appropriate for investigation in a primary care setting. It's actually a very good opportunity for GPs, GP researchers, clinical researchers, primary care researchers to actually apply for these grants. And I'm pointing this out specifically because these are the smaller opportunities that need to be made available for general practitioners and general practices. When I started off, this was the challenge that I had. I found it really challenging to actually get the appropriate funding or the support or the help for maybe some qualitative or quantitative studies. And some of those things are changing. And I'm really proud to say that being part of the RACGP as well, that shift has made a tremendous difference. We can apply for grants. There are lots of grants that are available. But it's the new researchers that need to be supported. Writing a grant is not an easy job. They need to be mentored, and I've been very lucky to have mentors along the way to support me in this journey. Recently, I was involved in a project in looking at what the general practitioner outcomes are when assessing a patient who has been given a result of dense breasts. So dense breasts is a common test result that we receive when women go through mammograms, their screening mammograms. The challenging area there, and this is an evolving space, and there are many other clinical researchers who have brought out data in this space as well. And it's very challenging sometimes to know exactly what to do when a patient presents with a result saying, my mammogram result says there are dense breasts. So we did a qualitative research in understanding what the general practitioner perceptions are around this. Another research that I was involved in recently is looking at the longitudinal clerkship of medical education for general practice. So medical students go through general practice rotation, but more importantly, when they are actually in a placement for a longer period of time alongside other non-GP specialisations, the research was looking to see whether they would actually have better appreciation of what a general practitioner does. So the student is actually following the patient along that journey from their non-GP specialist rotation to their GP rotations. These are a couple of the examples that I have been involved in recently. I have worked with the Cancer Council nationally, as well as the Cancer Council in Western Australia. I have also worked with the Royal Australian College of General Practitioners through the Foundation Grant, and also with smaller projects with the universities located in Western Australia and across the states. Research is a really important component in a scientific field like medicine, and in general practice where preventative healthcare, chronic disease management and acute care management plays an integral role alongside medical education. Research actually helps to have better outcomes for patients. And my passion for that is patient outcomes, but more importantly, it actually helps to inform health policy. It helps to change health policy. Unless and until we have data to prove that these are the conditions or the impact that we can have for patients or the impact it can have at a larger scale for a community, health policy shift is not going to happen. I love cycling. I cycle a lot, and I actually love watching a lot of binge TV shows as well, which I ask recommendations from my students as well as my colleagues. And the times that I'm actually not travelling or not at work, usually at home, and I think my husband might say that I do love shopping, although I don't know if I want to really admit to that.